Thank you for joining us. Today we are going to talk about diabetes. Diabetes is a chronic metabolic disease characterized by elevated levels of blood sugar, which over time can lead to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. Why is diabetes important to talk about? It's important because it's very common. More than 400 million people around the world are affected, and 7 or 8 out of every 100 people in the United States are diagnosed with diabetes. Some important risk factors include family history, ethnicity, obesity, very low birth weight or very high birth weight, high childhood weight, physical inactivity, and cigarette smoking. Unhealthy eating habits such as consuming too much red meat, processed meat, and sugar-sweetened beverages can also contribute to diabetes. There are many different types of diabetes, and we will focus on the most common forms here, including type 2 diabetes, type 1 diabetes, and gestational diabetes. Type 2 diabetes is the most common type of diabetes in adults, making up more than 90% of diagnoses. It is characterized by high blood sugar, insulin resistance, and relative impairment in insulin secretion. Genetic factors are important, as well as environmental factors such as obesity, as mentioned earlier. Type 1 diabetes is the second most common type of diabetes, making up 5 to 10% of diabetes diagnoses. In type 1 diabetes, there is an autoimmune destruction of the pancreatic beta cells. So the body self-destructs its own cells producing insulin in the body, which leads to absolute insulin deficiency. Since there is no insulin in the body, and insulin is very important to stay alive, these patients have to be on insulin forever and should not stop treatment. If they stop treatment, they can die even in a few days. Gestational diabetes is a form of diabetes diagnosed during pregnancy. It's usually diagnosed between 24 to 28 weeks of pregnancy with oral glucose tolerance tests known as sugary drinks by the OB doctors. Sugar control is very important for the baby's health, so these patients should be followed very closely every 2 weeks or so. The typical symptoms for diabetes are frequent urination during the day or overnight, increased thirst, blurred vision, and weight loss. Here we will be talking about how diabetes is diagnosed. There are several ways to diagnose diabetes. The first way is the Hba1c test. The A1C test measures average blood sugar for the past 2 to 3 months. The advantages of being diagnosed this way is that you don't have to fast or drink anything. Diabetes is diagnosed at an A1C level of 6.5% or greater. Another test is the fasting plasma glucose test. This test checks your fasting blood sugar levels. Fasting means not eating anything or drinking anything except water for at least 8 hours before the test. This is usually done first thing in the morning before breakfast. Diabetes is diagnosed as a fasting blood sugar of greater than or equal to 126. The next test is an oral glucose tolerance test. The OGTT is a 2-hour test that checks your blood sugar levels before and 2 hours after you drink a special sweet drink. It tells the doctor how your body processes sugar. Diabetes is diagnosed at 2-hour blood sugar of greater than or equal to 200 mg/dl. A random plasma glucose test can also be used to check for diabetes. This test is a blood check at any time of the day when you have severe diabetes symptoms. Diabetes is diagnosed at a blood sugar level of greater than or equal to 200 mg/dl. In summary, if there are symptoms, any random blood glucose level of 200 mg/dl or higher can be used to diagnose diabetes. If there are no symptoms, you need to have 2 different tests or repeated abnormal tests from among the following: a fasted plasma glucose level of above 126 mg/dl, a 2-hour plasma glucose value of over 200 mg/dl during a 75-gram oral glucose tolerance test, or A1C values of 6.5% or greater. What is prediabetes? Before people develop type 2 diabetes, they almost always have prediabetes blood sugar levels that are higher than normal but not yet high enough to be diagnosed as diabetes. This condition puts you at higher risk for developing type 2 diabetes and cardiovascular disease. Uncontrolled diabetes has many consequences, including stroke, heart attack, kidney dysfunction, erectile dysfunction, neuropathy, which can cause severe feet infections or amputations, gastroparesis, or delayed stomach emptying, and unfortunately, blindness. If you have advanced diabetes, you might end up seeing like these. Remember that diabetes is the #1 cause of blindness in the US. It is preventable, so it's important to follow up with your eye doctor. What can we do to prevent diabetes? Behavioral modifications, healthy diet choices, physical activity, smoking cessation, weight loss are the major preventative strategies. What kind of treatment options are available? Lifestyle modification is always the first treatment choice. Some other treatment options include oral medications. Many oral agents are available. They have different benefits, so they should be tailored based on the patient's other risks and diseases. Insulin is the main treatment for type 1 diabetes patients and for some type 2 diabetes patients. There's also once a week or once a day injections, which are different from insulin. An insulin pump can be another option, and it provides continuous insulin. Some diabetes medications have weight loss benefits, and some of them are heart and kidney protective. All of these treatment options should be discussed with your doctor. Diabetes patients should be monitored very closely. Some ways to monitor include a physical exam and diet review every 3 months, an A1C check every 3 months, a lipid panel to check for cholesterol every year, a kidney function test every year, a urine test to check if there is any protein leak from the kidneys every year, an eye doctor appointment every 1 to 2 years, and a feet check at least once a year by the provider and once a week by the patient. These are my main sources, also some pictures received online through Google search. Thank you for your attention. I wish you happy and healthy lives.